It was 98 before. What is it now?
Oh, well, I don't feel no pain anymore. The reason why I came here because I had problems on my lower back and also my foot. I had problems on my foot. For some reason I had trouble standing and sometimes I had trouble sleeping. My back also hurts a lot, and that's the reason I came to you, because every time that I go to another doctor, they always tell me that, oh, I'm fine, and then sometimes that appointment lasts for about 10 to 15 minutes later, and then sometimes the pain, it gets a little worse. And
I know that you do security jobs, so you do a lot of standing up. So how's that actually impacting you with your foot pain?
Well, sometimes it hurts because I used to have a pulse standing up.
Okay.
And sometimes I would stand for hours and hours, and I can actually feel the pain in my foot getting worse and worse. So that's reason I decided to get another security job where I have to sit down because I can't stand for hours.
So it's needless to say that not being able to stand for a long time, even at this stage, this should be like the peak health of your entire life, your 20s and your 30s, and your teens also, but you're not able to stand for a long time. So there's something going on. Would you agree with me?
Yes.
All right. Along with your foot pain, I want to be able to kind of ask you also what's going on with other body parts. You kind of mentioned about your lower back pain, yes?
Yes. I started noticing the pain ever since I was either in my teens or probably in my early 20s, and then every time I sleep on the couch, all of a sudden, every time I wake up in the morning, all of a sudden I start having pain on my back, and then every time I try to go back to sleep, it's kind of hard for me to sleep because my back keeps hurting and hurting.
Okay.
And sometimes it's very hard for me to sleep.
So that has been going on for how long now? Your lower back pain?
I think a couple years.
Couple years. And your foot pain has been ongoing for how long now?
Since 2020.
So it's almost the same time that your lower back and your foot pain has kind of occurred, yes?
Yes.
All right. So do you remember which one you got first, your lower back pain or your foot pain?
I think it was the lower back pain.
Okay, so you start to have a lower back pain first, and you start to get a foot pain after.
Yes.
I can see that you have what we like to call flat foot. You absolutely have collapsed arches here, like I'm sure somebody told you about that, yes?
Yes.
Flat foot, and then that's probably what the doctors have said to you. Your flat foot is causing your foot pain, so go to see a foot doctor, and foot doctor will give you some kind of a treatment for flat foot and you'll feel better. That's probably you've been told, yes?
Yes.
Yeah. So it's undeniable you have a flat foot, and then that can also cause a lot of problems on its own. But usually when you have a problem, it's multifactorial, which means that there's more than one reasons why you have a problem. For instance, if you have, let's say, one health condition, let's say that you have a cold, you have a fever. That could be due to because maybe you slept cold the night before, maybe you didn't eat so well for the week in advance, maybe you were playing outside in the snow, 3 days snow without wearing too many things. What I'm trying to tell you is there are more than one reasons why you can get a disease or illness. So this is no exception. Yes, so your flat foot can definitely contribute to your problems of your foot pain, but what I'm trying to tell you is that it may be incomplete. So that's the reason why a lot of times when people go to see a foot doctor and get a treatment for their flat foot or high arch foot, what have you, sometimes that's not enough. Why? Because they're not getting the entire story. In order for me to be able to treat your foot pain, I have to treat the entire story. It cannot be just half or partial stories too. I have to treat the entire things. Does it make sense to you?
Yes.
Okay. So your foot actually is your foot and your leg are actually extensions of your lower back function. A lot of your lower back nerve actually travels from your lower back area to your knees, to your knees, to your leg, to your thigh, as well as your foot and ankle. All the nerves actually comes down over here and controls the functions of the movements, muscle tones, how you move. It's all dependent on your lower back and the master control center of your lower limb, which is your legs and your thighs and your foot and ankle, okay? So I'm going to go ahead and then ask you to just kind of push this up. I'm going to go ahead and compare the strength between your left and right side of your leg and thighs and your foot and ankle, just to be able to see exactly how much of a difference of the strength there are, okay?
Yes.
Go ahead and push up, please. Push up. So, you are 28 years old. This is very, very weak already.
It is?
Yes, go ahead and push up, please. You cannot push up really easily. Go ahead and push this up. See, you can push up with the left side, okay? Push up with the right side. It's difficult, isn't it? I put same amount of pressure to the left and right side. You cannot even push up as easily to the right thigh. Does it make sense to you?
Yes.
Push down, please. You cannot even push down.
Oh.
You cannot even push down. Feel this. Push down. You can push down with it. See how your foot is actually going down? Because I'm putting the exact amount of resistance in both. Push this down. You can't. You can. Isn't that strange?
Yeah. Oh wow.
One more thing that I'll let you know is that your muscles, I don't know if anybody ever told you about this, are much smaller here as opposed to here. That tells me whatever has been ongoing over here is old enough, certainly more than 2 years, that muscle are actually smaller and weaker, because just like how you can get a bone arthritis, you can get a degeneration of your muscles, so you start to lose muscle mass and strength. So this actually feel the muscle tones here and here. This one feels very stiff. This one feels hard, rigid, solid. This feels like a kitty water balloon right here.
Wow.
Feel it.
Oh wow.
Feel this.
Oh, I can feel it.
Did anybody tell you about that?
No.
One more thing I'll go ahead and do is that I need to know exactly how much muscle mass you have lost. So I'm going to go ahead and then put this around your, on your thigh, just right above the knees, just so that you and I can actually see exactly how much of a muscle mass there is. You can tell right now, 18.5. You can read it, right? 18.5?
Yes.
Okay. So here you can see it's 18.3. You can see the 18.3 right here. Yes.
Yes.
That tells me there are about 0.2 inches of the muscle tone that has been smaller. Not only that, your muscle is much more flaccid over here and weaker. Those three are smaller muscles, weaker muscles, and then flaccid muscles are signs of muscle degenerations.
Wow.
Does it make sense to you?
Yes.
Did anybody tell you about that?
No.
This is very, very significant for your foot pain. Does it make sense?
Yes.
Because what? All the muscle supplies and nerve supplies to the foot has to go through here. So if this gets compromised, guess what? This also will be also weak too. Push this out, please. Push this out. Push this in. You can even push in, can you?
No.
Push this in. You see, okay, push me again. You see I'm actually coming with you here like this, I'm actually coming to you because you're strong enough. Push this. I can hold all day. In fact, I'm going to use 2 fingers. Push in. I can still holding it.
Wow. Yo, that is strange. Nobody's ever told me this before.
You know why? Because the examination, what they were doing is incomplete. That's the reason why this exam portion is 2.5 hours.
Wow.
This is the reason why I actually have to tell you all the things. You cannot just examine your foot and ankle area only when I'm trying to get to the bottom of your foot and ankle problem. It has to be a complete story. This is a complete story of your foot and ankle, not just over here. Does it make sense to you?
Yes.
Okay. One more thing that I'll let you know is that, it's also very, very different too. Feel your calf muscle right here. You see how it's kind of rigid over here and then really like stiff and then solid and strong. Feel this one, like motor balloon. Feel it.
Oh wow.
You were walking on your 2 legs for how many 28 years, you never really noticed this.
No.
Not until the doctor points out you don't really notice kind of things. What that tells me is the muscle in both sides are weak on your right side.
Wow.
So, we've established there are weaknesses on those 2 muscles right here. So we are gonna try to see exactly what the strengths are of the muscles of your both feet and ankle. All right. So what I'm gonna ask you to do is I'm gonna go and test your ankle strength here first. Go ahead and push your ankle up. Push your ankle down. Weak.
Wow.
This one you're actually able to push down easily. Here I can do with my two finger again. Why? Your ankles are weak because all these nerve supplies are weak. What does that mean to me and to you is there are some kind of problems above your leg area that are malfunctioning that does not allow this, your entire right lower limb to function properly. Is that fair to say?
Yes.
What's above your leg? Your pelvis and your lower back. So what does that mean to you and me? Your foot problem may not be foot problem.
Oh.
Yes, you do have a flat foot. Yes, that can give you pain. Yes, treating your flat foot can definitely improve your condition, but it's not complete. Why? Because more than that, there's a huge amount of pressure somewhere in your lower back area is causing all this. So if I just treat the foot alone, it may not be enough. Now, does that make sense to you?
Yes.
Look, your left side, soft. Soft like a Charmin toilet paper. I'm just kidding, but you understand what I'm trying to say.
Yeah.
It's very, very soft. It's very, very soft. It's almost fluffy. So that means there's no muscle rigidity. This side is not spastic. Feel the right side. You see how tough this is?
Wow.
You see how tough this is? You see what? You see this is like rock solid. This is like a baby's touch. Very soft. Rock solid. Soft. Solid. Soft. What that means to me is there's some kind of structural problem here. Here. That makes this muscle to be permanently rigid. This one to be permanently soft. Does it make sense?
Yes.
So if I push over here, it's actually almost like a plump. It's almost as if you have another extra layer of water between your skin and then your body. So there's a lot of waters over here. Less over here, but more water retention. This water that you feel what I'm feeling too, yes?
Yeah.
This water is what we like to call swelling. So when people say, hey, my body is so swollen, that's water. And that's exactly what it is. So all in all, rigidity, high water content via swelling, that tells me there's some kind of structural problem here that's actually causing probably your lower leg instability, causing your foot pain and your lower limb, your leg and your thigh of your right side to be weak and flaccid. Does it make sense?
Yes.
Alright, so I'm going to go ahead and run the instrument on your spine right here. And then voila. I found number one problem right here. Notice I'm actually running down my finger through. You see how this skin is dry right here?
Yeah.
You feel dryness of the skin? But it's pretty nice, but the dryness right here, right? You feel dryness. It's not because you didn't put lotions over here, you put lotions elsewhere too. There's not natural oils being produced to this area. That means there's an active nerve pressures right here. Why? Even small things like in producing oils for your skin lubrication, that's controlled by what? Guess what? Your nerve function. So that's exactly, yeah. And I also found another problem right here. You see everything from here and down is actually all what? Very, very dry and scaly skin. It's not because you didn't put lotions over here, it just means it's not, whatever is going on over here, the nerve is not functioning properly. Right here is where I found the pain, right here.
Yeah.
I'm sorry, excuse me. You feel that, right? How about right here?
I can feel it a little bit.
Yeah, right here, right? You see this?
Yeah.
Curvatures right here?
Oh, wow.
There's a lot of curvatures on this spine.
How did... Oh, damn.
So I want to be able to let you know, you might be asking, why does this happen? I don't understand why. Is that normal? That probably will be what's going through your mind, yes?
Yeah.
I want to be able to let you know that this actually is not an accident. There's a reason why you actually have this. My friend, most of the people have 5 lumbar bones, which means that there's 5 lumbar bones that actually makes your lower back. In your case, you have 6. This sacrum bone almost became a lumbar bone, but it did not really finish the process. It became kind of half in, half out kind of thing. Does it make sense to you?
Yes.
So that's exactly what happened. So that's the reason why there's absolutely no spaces over here, but you see Space over here, space over here, space over here, space over here. This curvature right here has been caused by what? Some kind of problems over here, biomechanical alterations. So this problem, unfortunately, you told me that you've been having problem for 2 years, right?
Yes.
This did not happen 2 years ago. In fact, the problem that has been ongoing over here, this problem over here was since birth. This is since birth that you actually have a problem. You just didn't know about it. Why? Because it's unnatural for anybody in their teens or in their early, when they're in their childhood to have a lower back pain. So you never really noticed it. You start to notice your all these kind of problems as you get older, because guess what? It was not really being fully treated. That's the only reason. Because of this extra the extra lumbar bone right here that you actually have, it's actually creating this kind of curvatures right here. This can actually get worse with a unstable foundation. Why? If you build a house on a sandy foundation, very unstable foundation, what happens? Everything tilts to one side, yes? If you don't have a good foundation, everything just kind of flops around on top, yes?
Yeah.
That's exactly what's happening with you. In addition to you having 6 lumbar bones, that's kind of giving you a little more challenges for your biomechanics. Notice the sacral bone right here, this tailbone right here, where your entire body sits on, this sacral bone, the bones in the tailbone right here. Guess what? It's actually unstable. Your right foot, it's normal. It's not even that flat. So yeah, it's a little bit flat. There's some amount of I see some misalignment in your foot, which is also due to accommodating to structural changes coming from up top, but it's largely okay. There's no really big problems over here. That's the reason why when you went to see a foot doctor, they was like, oh, it's fine. Man, everything's okay. No problem. Yeah, it's okay. You'll get better. You know why? Because they only look at the foot and they don't look at anything else. They say, oh man, everything else is okay. But they didn't look at the entire body of yours to tell you exactly where the problems are lying. So they didn't know about it. Your foot itself looks okay. Left foot looks even better than right foot. You have so much pain, but your x-rays are fine. They'll probably say, I don't know what's going on with your feet. Looks like that you have a problem, so I'll just send you to physical therapy, see how you do. That's probably the end of the conversation over there. Why? Because they did not examine the entire story of your foot and ankle problem. This is the reason why I had to ask you why you have a foot pain, why you have a low back pain, how long it lasts, which came first. All the kind of things that I'm actually trying to get is for this reasons. Because I need to get a complete story out of your condition so that I know exactly how to track back. Does it make sense to you?
Yes.
Okay, I'm going to go ahead and sink you just a little bit. You're going to feel. There we go. All right. How does that feel?
Oh, feel good.
Walk around, see how that fits.
Feel good.
You feel good?
Yeah.
Walk around more. Tell me what the changes with your feet. I only took care of your one tailbone. How's your foot feeling?
Let me see. I don't feel no pain on my foot.
Hey, that's pretty good. 0 to 100%, how much improvement do you feel on your feet condition right now?
Oh, let's see. I say about like 98%.
You still have flat foot. Last time I checked, I didn't remove your flat foot. You still have the same condition of your foot. 98% of your foot pain went away just by me taking care of one single tailbone problem. That's exactly what has happened. Isn't that amazing?
Yeah.
Yeah. How much of improvement do you feel in your lower back?
Like a scale from 1 to 10?
Yes.
I say about an 8.
It was 98 before. What is it now?
I don't feel no pain anymore on my foot.
That's exactly what I mean. Yes, you do have a flat foot. Yes, you do have a collapse of arches that's giving you pain. But guess what? You're able to have all of your foot pain removed just by me taking care of your real problem. That's exactly the reason why you're here. That's exactly the reason why we're doing all this. This might...